Have you ever left a lab wondering if your blood test was even accurate? Or worse, you got a result that didn't feel right, and it left you worried? If that's ever happened to you, you're not alone. Many older adults, especially women over 60, unknowingly make a few small mistakes before their blood tests that can change the results, sometimes leading to the wrong diagnosis or extra stress you didn't need. And it's not because you did something big. It could be something as simple as drinking the wrong thing, wearing a tight sleeve, or taking your usual supplement at the wrong time. I've seen these things happen so often, and they're completely avoidable. In this video, I'm going to walk you through the 10 most common mistakes older adults make before a blood test, and more importantly, how you can avoid them. Some of these might surprise you, especially number 9, which even nurses sometimes overlook. So if you want your results to truly reflect your health and not a little misstep, I invite you to stay with me till the end. Before we start, I'd love to know, where are you watching from today? Just drop your state or city in the comments below. And if you have any natural health tips of your own, feel free to share those too. Someone else might really benefit from hearing what's worked for you. 1. Forgetting to fast, or fasting too long. This is one of the most common reasons blood test results come back inaccurate, and honestly, it's not your fault. Fasting seems simple, don't eat or drink anything before your test, but it's easy to get it wrong. Some people forget and grab a cup of coffee with milk or nibble on toast in the morning without thinking. Others go to the opposite extreme and fast too long, thinking it'll give them a cleaner result. But both of these can affect your numbers in ways you might not expect. If you eat even a small snack or drink something like juice, sweetened tea, or coffee with cream, your glucose and cholesterol levels can rise, and that can make your doctor think you have a condition like prediabetes or high triglycerides, even if you don't. On the other hand, if you fast too long, let's say more than 12 hours, your body might become stressed, raising cortisol levels and changing how your kidneys, blood sugar, or even your sodium look in the results. And for older adults, especially women, this can lead to dizziness, fainting, or even misleading results that make it look like something's wrong when it's not. The sweet spot is 8 to 12 hours, not more, not less. So if your test is at 8 a.m., stop eating by 8 p.m. the night before. During the fasting window, the only thing you should have is plain water. No flavored drinks, no lemon water, no herbal tea, just water. And if you're not sure whether your test even needs fasting, just ask your doctor or lab. That small check can save you from confusion later on. Getting this step right can make sure your results reflect your real health, not a small mistake. 2. Taking medications or supplements that affect test results. This is something most people don't even think about, and honestly, many doctors forget to mention it too. But the truth is, a lot of common medications, vitamins, and even herbal supplements can quietly interfere with your blood work. And you wouldn't know unless someone tells you. These small things can make your results look unusual, even when you're perfectly fine. For example, biotin, the vitamin often found in hair and nail supplements, can completely mess up thyroid test results. It might make it look like your thyroid is overactive or underactive, when really, your thyroid is doing just fine. And this could lead to unnecessary follow-ups, stress, or even adjusting a medication that didn't need to be changed. Pain relievers like ibuprofen or naproxen, which many older adults take for arthritis, can affect kidney function tests. Steroids like prednisone can raise your blood sugar or white blood cells, making it seem like you have an infection. Even common over-the-counter antacids can change calcium or magnesium levels. And let's not forget fish oil, turmeric, St. John's wort, or other herbal remedies. They may be natural, but they still affect your body chemistry. Your body doesn't separate a vitamin from a medicine. It just reacts. So what should you do? Make a full list of everything you're taking: prescription meds, over-the-counter pills, supplements, herbal teas, protein powders, everything. Give this list to your doctor and also to the person drawing your blood. Sometimes your doctor may ask you to pause a certain supplement 24 to 72 hours before your test. But never stop a prescribed medicine without asking. Safety always comes first. The goal here is not to hide what you're taking, but to help your healthcare team get a clear, honest view of your health. 3. Not drinking enough water before the test. This is one of the easiest mistakes to make, and also one of the easiest to fix. A lot of older adults think that fasting means avoiding everything, including water. So they show up to their blood test dehydrated without even realizing it. And that one little thing can make the entire process harder, for you and for the nurse. When you're not well hydrated, your veins can become harder to find. They flatten out or hide, which means the person drawing your blood might have to try more than once, or move to a less ideal spot like your hand. That can be painful and frustrating, especially if your skin is thin or if you bruise easily. I've seen women leave the lab with sore arms, all because they didn't drink a glass of water that morning. But it's not just about making the blood draw easier. Dehydration can also affect the actual results. Your blood becomes more concentrated, which can make things like your red blood cell count, hemoglobin, or BUN, a kidney marker, appear higher than they really are. It might even look like you're low on sodium or potassium when you're not. That's how easily dehydration can give your doctor the wrong picture. So here's what to do, unless your doctor specifically tells you not to drink water, which is rare. Have a glass of plain water an hour before your appointment. Not juice, not coffee, not flavored water, just water. Also, start drinking water consistently the day before your test. Sip throughout the day and have one more glass before bed if your stomach allows it. That way, you'll show up with veins that are easier to find and blood that truly reflects your health. It's a small step that makes a big difference. 4. Exercising too hard the day before your blood test. Staying active is a great habit, especially as we get older. Gentle movement helps with balance, heart health, and even mood. But if you do a heavy workout the day before your blood test, like lifting weights, doing intense cardio, or even a long hike, it can throw off your results in ways that might surprise you. Here's why. When you exercise strenuously, especially something that works your muscles hard, your body starts releasing certain enzymes into your blood. These include markers like CK, creatine kinase, ALT, AST, and LDH, which are usually checked when doctors are looking for liver issues, muscle problems, or even signs of heart strain. But after a workout, those markers go up naturally, even if you're perfectly healthy. And if your doctor doesn't know you exercised the day before, they might think something's wrong when it's not. I've seen cases where women got referred to specialists, repeated blood tests, and even had ultrasounds, just because they did a fitness class the day before. It wasn't illness, it was just muscle recovery showing up on paper. So if you know you have a blood test coming up, give your body a break 24 to 48 hours before. That doesn't mean you have to sit still, you can still go for a short walk, do some light stretching, or even gentle yoga. Just avoid anything that gets your heart rate way up or leaves you sore the next day. This is especially important if your doctor is checking things like liver function, inflammation, or muscle health. By resting your body before the test, you help make sure your results reflect your regular, everyday health, not just what happened during your last workout. A little rest now can save you a lot of confusion later. 5. Arriving anxious, rushed, or flustered. You might not think your emotions can affect your blood test, but they absolutely can, especially when you're already a bit nervous about needles or running late. When you arrive at the lab feeling anxious, out of breath, or stressed, your body reacts, and that reaction shows up in your blood. Here's what happens: your body goes into a mild fight or flight mode. That's when stress hormones like cortisol and adrenaline kick in. These hormones can raise your blood sugar, your blood pressure, and even change your white blood cell count. So if your doctor is checking things like glucose, stress levels, or anything related to inflammation or your immune system, your results might look off, not because something's wrong, but because you were just tense or flustered. One of my older patients once came in after getting stuck in traffic and nearly missing her appointment. Her test showed high glucose and cortisol, which led to concerns about diabetes and hormone imbalance. But when we repeated the test a week later, and she arrived calm and early, everything came back normal. It was just stress that affected her results the first time. So what can you do? Try to arrive 10 to 15 minutes early. Find a quiet spot in the waiting area, close your eyes, and take a few slow, deep breaths. Don't check your phone, especially if you're tempted to read news or medical articles. Just give your mind and body a moment to settle. Think of it like setting the baseline for your body. If you come in calm and steady, your results will show your real health, not just how you felt in a stressful moment. That small bit of peace can make a big difference in your results and in how you feel overall. 6. Not asking which tests need special preparation. Many people, especially older adults, assume that all blood tests are the same. You fast, you show up, and they draw your blood. But the truth is, different blood tests have different requirements. And if you don't know exactly what's needed for your specific test, you might do something that throws off the results, even if you followed the basic instructions. For example, some tests absolutely require fasting, like glucose, triglycerides, or a full lipid panel. Others, like a thyroid panel, don't need fasting, but they're best done early in the morning when hormone levels are most stable. If you're doing iron studies, the timing matters too, and you shouldn't take an iron supplement right before the test. Hormone tests like cortisol or ACTH are very sensitive to the time of day, and should ideally be done between 7 a.m. and 9 a.m. Also, things like calcium, parathyroid hormone, or vitamin D levels can be affected if you've recently taken supplements. And if you're using hormone replacement therapy, even over-the-counter estrogen creams, those can change how some tests are read too. Now here's where the mistake happens. People assume the doctor or lab will give them clear instructions. But that doesn't always happen. Sometimes the lab is busy. Sometimes the instructions aren't printed out. And sometimes we just forget to ask. So the best thing you can do? Call your doctor's office or the lab a day or two before your appointment. Ask directly, do I need to fast for these tests? Should I stop any supplements? It only takes a minute, but it could save you from getting the wrong result, or from having to go back for another draw. Your health is too important to guess. A quick question now can make sure your results are clear, accurate, and truly reflect your body. 7. Drinking alcohol the night before your test. Now, let's be honest, for many older adults, especially women over 60, enjoying a small glass of wine with dinner is part of a peaceful evening routine. And I'm not here to judge or tell you to give that up completely. But if you've got a blood test scheduled the next morning, that little drink could quietly throw your results off more than you realize. Even moderate alcohol, just 1 or 2 drinks, can affect key blood markers. It can raise your triglyceride levels, which may lead your doctor to think your heart health is worse than it is. It can also temporarily increase liver enzymes like ALT and AST, and that can cause concern about possible liver issues, even if your liver is perfectly fine. Some people even get referred for extra tests or scans because of this, all because of one drink the night before. Alcohol can also dehydrate you, which makes your blood more concentrated and harder to draw. On top of that, if you're taking medications for diabetes or blood pressure, alcohol might interact with them in a way that affects your glucose levels or electrolyte balance. In short, it can confuse your results and make things look worse than they really are. So what should you do? The safest approach is to avoid alcohol for at least 24 hours before your blood test. If your doctor is checking sensitive markers, like liver function or cholesterol, then giving yourself a 48-hour alcohol-free window is even better. Instead of your usual evening drink, try a soothing herbal tea, sparkling water with lemon, or even just plain water. It's a small adjustment for one evening, but it gives your body the chance to show its true health. One night without alcohol can give you peace of mind, and a more accurate report. 8. wearing tight sleeves or hard-to-remove clothing. It might not seem important, but what you wear to your blood test can actually make the whole process much easier, or much harder. A lot of women, especially in cooler weather, wear long sleeves, fitted blouses, or layers that are tricky to roll up or take off. But when it comes time to draw your blood, those clothes can become a real hassle, for both you and the person trying to find your vein. If your sleeve is tight, it can act like a second tourniquet, cutting off circulation and making your veins harder to see. Sometimes the phlebotomist has to search longer, try another spot, or ask you to change arms. And if they still can't get a clear view, you might end up getting stuck more than once, or they might have to use your hand or wrist, which can be more painful. I've even seen situations where women had to half undress in the lab chair just to get access to their arm, and let's be honest, that's not a comfortable position for anyone, especially in a cold clinic with people walking around. Not to mention, it can make you feel rushed, flustered, or a little embarrassed, none of which help when you're already a bit nervous about the test. To avoid all that, just keep it simple, wear a short-sleeve top, or bring a cardigan that opens in the front so you can slide it off easily. If you like layering, make sure the layers can be moved without a struggle. Think comfort, think access. This small choice makes the whole appointment smoother. It helps the nurse do their job faster, reduces your chances of bruising, and gets you in and out without extra stress. One thoughtful outfit can make a real difference in your experience. 9. Not mentioning menopause or hormone therapy. This is one of those details many women don't think about, but it's incredibly important. If you've gone through menopause, had a hysterectomy, or are using any form of hormone replacement therapy, HRT, your doctor and the lab absolutely need to know. And not just in general, they need to know exactly what kind of hormone you're using, how you're taking it, and when you last took it. Why? Because hormones like estrogen and progesterone affect many things in your blood. They can influence your cholesterol levels, your thyroid test results, your calcium, and even liver function. For example, women on estrogen therapy often have higher HDL, that's the good cholesterol, and lower LDL, the bad one. If your doctor doesn't know you're on HRT, they might wrongly think your lifestyle changes are working better than they are, or they might miss something that's being masked by the hormones. I've seen situations where a woman's estrogen patch wasn't mentioned, and it led to a misread test. Her doctor thought her hormones were naturally high and ordered unnecessary follow-ups. It caused worry, more appointments, and a lot of stress, all because the lab didn't know she was using hormone therapy. So here's what you should do. Before your test, tell your doctor and the person drawing your blood if you're postmenopausal, and whether you're using any hormones, even creams or over-the-counter patches. Be specific. Say, I'm using a progesterone cream, or I take estrogen pills daily. If possible, mention the dosage or when you last used it. This one step can help your healthcare team read your test correctly. It's not oversharing, it's giving them the full picture of your health. And it can save you from unnecessary confusion later on. 10. Leaving right after the blood draw without double-checking. It's completely normal to feel relieved once your blood test is done. The needle's out, the tubes are full, and you just want to head home. But before you grab your bag and walk out the door, there's one last important step, and it only takes a minute. Skipping this part could lead to delays, mistakes, or even having to come back again for another draw. Here's what I mean. Sometimes in busy labs, a test might accidentally get skipped. If your doctor ordered multiple tests, say, cholesterol, thyroid, kidney function, and hormones, and one of those vials wasn't taken, you won't know until later when the results come back incomplete. That could mean repeating the whole thing, which nobody wants. Other times, the lab might not draw enough blood for a certain test. Some tests need a full tube to work properly. If it's underfilled, the machine might reject it, and your sample becomes unusable. That's especially true for delicate tests like hormone panels or clotting studies. There's also the rare but serious issue of labeling. If your vial doesn't have your correct name or date of birth on it, it could get mixed up with someone else's, and that's a situation no one wants to deal with. So before you leave, just do this: ask the phlebotomist, did we get everything today? Enough for all the tests? And glance at your vial labels, check that your name and birthday are right. If you notice anything off, speak up immediately. Also, ask how and when you'll get your results. Will they call you? Should you check an online portal? Do you need a follow-up appointment? Getting clear on this saves you from unnecessary waiting or confusion later. That one extra minute at the end of your appointment can make sure your test results are accurate, complete, and stress-free. It's a small habit that puts you in charge of your health. So there you have it, 10 simple but powerful things to keep in mind before your next blood test. None of these tips require fancy equipment, medical training, or big changes. Just a little preparation, a bit of awareness, and the willingness to speak up for yourself. And the reward? You get results that are more accurate, more reliable, and truly reflect how your body is doing, not how it was stressed, dehydrated, or thrown off by a supplement. Now I want to hear from you. Which one of these mistakes have you made before? Or which tip are you going to start using from now on? Let me know in the comments. Your experience might help someone else watching too. And if you found even one thing helpful today, go ahead and hit that like button. It lets me know I'm creating content that matters to you. And of course, subscribe if you haven't yet, because we've got more honest, practical health talk coming your way soon. Stay well, take care of yourself, and remember, your body has a voice. A blood test helps us hear it. Let's make sure it speaks the truth. I'll see you in the next video.